hepatitis is the inflammation of the wound. For example, you have pain, you have all the symptoms that will cause the discomfort and all that. So the inflammation can be caused by many different agents. One of them is alcohol. If you consume a lot of alcohol, it goes straight from the stomach, passes through the hepatic portal vein, it goes straight to the liver. And it can cause all the symptoms of inflammation. So if you hear anything, hepatitis, so that is actually about inflaming the liver. And other things which can cause hepatitis include abuse of drugs, those peddlers on the road, people buy all sort of things to drink. It can also cause hepatitis. But the one that we are focusing on is the viral hepatitis. And the interesting thing is that whether it is by alcohol or by those drugs that you abuse in the liver, they all end up inflaming the liver. And the liver is a very important organ in the body. Very, very important. It stores glycogen, releases it to release energy for us. You know, it regulates the albumin, the protein level, so that you don't have excessive blood fluid levels, so that edema and things like that cannot happen. And other things which I cannot enumerate here. So it is a very important organ. But it is also exposed to excessive abuse. As I mentioned, alcohol, for example, is consumed widely when we are going to parties and so on. And unfortunately, the liver does not have this innervation which can help us to feel pain. And have you heard about anybody saying, my liver is paining me before? You haven't heard. So, but when you look at inflamed liver, it has all the symptoms which appear clearly that it is really in pain. So, hepatitis can be a condition which can be so serious, but you don't have any signs to help you immediately to show that you are in pain. And so if you have viral hepatitis, the symptoms will show. Now, there are some viruses to which infect the liver, but we don't call them hepatitis viruses. For example, yellow fever can infect the liver, cause symptoms like hepatitis, but they are not called hepatitis viruses because they are transiently in the liver. We have Epstein-Barr virus, that's the same. But there are some viruses which, no matter the route of infection, when they enter the body, they will always target and end up in the liver. And that is where they cause their major disease. And these are the ones that we call hepatitis viruses. So it is not every virus which infects the liver which is called hepatitis viruses, which are called hepatitis viruses, but those which target the liver. And we have a property of the virus and the organ, which we call tropism. And that is what leads to the infection or targeting of the liver by these viruses. There are more than 6, but we normally focus on 6 which are medically important. And even out of the 6, 5 are the key ones that we always talk about. And these are the hepatitis A, B, C, D, E. There's no F. Then you have the G. So there are 6. So remember that there's no hepatitis F. We only have A, B, C, D, E, and G. Now, out of the 6 We have some which are fecal-orally transmitted. That means they are transmitted by contamination of food and water. And these are the A and the E. Then we also have those which are transmitted by body fluids. For example, we have the blood and so on. Open wounds, the fluid from open wounds, all this can contain the virus. Then these blood transmitted ones to also tend to be transmitted sexually. So we have sexual transmission. Then we also have those which are from drug abusers, intravenous drug abusers. They can also transmit. So those which are transmitted by body fluids, especially the blood, can be transmitted by a needle stick injury and so on. One thing people ask is, can you have hepatitis transmitted by mosquitoes? I think you hear about this already. Okay. The quantity, the mosquito can take the blood, but the quantity in the blood is so small, so it will not be enough to transmit the infection. So mosquitoes cannot transmit hepatitis, those which are transmitted by the body fluids. Now let me talk about the hepatitis viruses transmitted by food and water. The first one I'll talk about is the A, hepatitis A. Before I go on, I also have to mention that all the viruses are different viruses. They are not the same. They belong to different groups of viruses. The A, for example, is a picornavirus. The B is a family called hepadnavirus, and so on. So they all belong to different groups of viruses, but they all have one feature, that they all target the liver as the main organ that they cause disease. So that is a common factor for all of them. So the A is fecal-orally transmitted. That is, you get it from contaminated food or water. And normally, how it contaminates the food is that when there is unhygienic environment, the virus, you find it in untreated sewage. You go to many big cities, you find what we call market gardening. People have these small gardens on the roadside, and they water the vegetables, especially carrots, lettuce, and so on, with gutter water. And people discharge the fecal material in these gutters, and when they water the vegetables, many of them will eat them raw. So you can see clearly how you can easily get this kind of infection. And the worst part of the A is that the virus is shed 2 weeks before the symptoms begin to appear. And during that 2 weeks, the person who is shedding the virus and spreading it around is not aware that he or she is spreading the infection. And normally we find this with food vendors. They carry the food around, and then they meet people. Oh, you stop by the roadside, you buy your small, I don't want to mention the food stuff, but you may never know how they wash their hands after visiting the washroom. So the virus may be on the hands, and they may use the hand also to serve the food. And then we also have foods where you use hand directly to stir and so on. So this is not difficult to spread. So the A is one of the spreads very quickly in communities, especially when there's unhygienic conditions. And so I mentioned already that it spreads before the symptoms begin to appear. And by the time the person is aware that he or she has hepatitis A, it has already spread around. There are vaccines for A as well, and you can take those vaccines to prevent the infection. Another group of people who can have danger of the A are the homosexual, those who, men who have sex with men. They are easily contaminated. They also have the propensity to have this sort of infection. So they are also given the vaccine. Then the E also spreads by this same route, but we don't talk about it very much. The reason is that the E actually is fatal in pregnant women. And the cases may be there, but you rarely see so many, there's not much emphasis on it. We normally confuse it with malaria. And there are situations where people may be treated for malaria for a long time. They go for tests and it doesn't show any malaria, but they still continue the treatment. It may be hepatitis E. And in the case of pregnant women, then it becomes a fatal disease. We've had some fatalities in some cases years back in Kolebu. So it is also a very important viral hepatitis. Then those ones we talk about often are the B, C, and even the D. The D is not. And as I've said, the B is mainly transmitted through blood contamination and also sexually transmitted disease. You find very high levels in the blood and fewer in other body fluids like sweat or saliva. Saliva is important only when there is a break in the or a lesion in the mouth. So you have swollen gums or lesions in the mouth which can bleed. So once the blood contaminates the saliva, you can get the infection. So that is where you have this disease. The hepatitis B is the most infectious virus, or one of the most infectious viruses known. When we say infectiousness, very small quantities, microliters, very tiny, can cause a full-blown infection. And it is also one of the most resistant viruses known. For example, if you have hepatitis B virus in contaminating blood, and you have a blood spill on the ground or even on the bench, in the normal environment, the virus can still be infectious after it has been exposed on the bench for 1 whole week on the ground. And so you just, and then you touch it, you get the infection. So that's how resistant or persistent that virus is in the environment. So it is not something that we should be joking with. And I mentioned one of the methods of transmission. You have needle stick injection infection. You find it mainly a lot in the health workers. So a lab worker wants, or a nurse wants to cap a needle after taking blood. Then you have your injection. You infect yourself. So needle stick injection is also. Now, there's one very important route of transmission, which is mother-to-child transmission. It is a very important route because the virus itself causes more severe disease when the infection occurs very early in life. So the earlier in life you acquire the infection, the higher the chances that you develop the chronic disease. And if you develop the chronic disease, you have higher chance of developing the liver cancer. So that is a major thing to be concerned. Then also, the earlier you have the infection in life, the lesser you have symptoms to the disease. So since children show fewer cases of the symptoms as compared to those who acquire the infection later in life. And yet they are the ones who become the chronic carriers and also develop the major disease, which is the liver cancer. And there are other diseases as well. We have liver failure, we have cirrhosis, and all this can come in between till you develop the final major disease, which is the cancer. So it is very, very important to prevent mother-to-child transmission and also to prevent acquiring the infection early in life. So infant vaccination of the young is very, very important. And when a mother is found to have the symptoms or the infection, normally they go for screening before birth. They have to be vaccinated. And there are some antigens that we use to detect the infection. You have surface antigen and the E. So this is very important. Now, how do you know whether the person has hepatitis B? What we normally do is we have screening tests. And the screening test that we do, we look for certain proteins in the virus. And the one that we look for is what we call the surface antigen. Hepatitis B surface antigen. So you go for, during many anniversaries, they have screening, which is very regular. And I think that is the purpose of this. So screening is very important. So we look for the antigen, surface antigen. And if the person is positive, then you have to go to the hospital for what we call profile. There are other antigens that we look for to see whether you are infected. The staging the disease. But if the person is negative after the screening, then the best thing to do next is to go for vaccination. And for the vaccination, I'll talk briefly about it. It's very important. There are schedules. There are 3 doses that you take. One you take after 6 months. First dose at, they'll show you that there are 2 schedules, so you can go for the one that you prefer. But the important thing I want to talk about is that the vaccine that we use for vaccination is a recombinant vaccine. It is produced in yeast. And you know, yeast and human being, maybe we are not the same. So the protein that is produced may not be well recognized in every human being. So when they give the vaccine, about 90% of the vaccinees, those who are vaccinated are called the vaccinees. But 10%, 10% of the vaccinees are not protected. But you can never know whether you are one of the 10%. So you have to go for what you call the antibody testing. That is after you've had your 3 doses to see whether you have seroconverted. Seroconversion means that you have developed antibodies to the antigen of the surface protein, the surface antigen. And that is the one which protects us. So you go for this antibody testing, and if you are found to be positive, then you are free. But if you are negative, then we have to go for another booster. And normally when they have the booster, they seroconvert. So that is a very important point which you have to take note about the vaccination. So you can vaccinate all age groups. And I've said that the earlier in life, the higher the chances of developing the main disease. So vaccinating young infants is very, very, very important. It's very good that you have included it in the schedules that you have for immunization during public vaccination campaigns. Now, there's also treatment for hepatitis B, but it's very expensive. So I will not recommend people to think that people because there's a good treatment drug, so they should lead careless life. No, no, no. The best thing is to avoid hepatitis B at any cost. Not that you get it and go and get treatment. It is not advisable. So prevention is better than to cure. Then we have the hepatitis B itself. The way the disease is caused, actually, it is the immune system which is the main cause of the disease. So people, well, of course, it's good to know that when the immune system detects that the liver is infected, it directs its action against the liver cells. The idea is to clear the infected cells, but eventually it goes to other affect the main liver. So that is how the disease manifests, and so we have to be very, very careful when we in this hepatitis B. Then the C. The C, as I've said, is also another virus, but it is also transmitted through blood contamination. It is milder than the B, but it causes a lot of cases of the liver cancer. And it also has various tests that we use for testing to screen for the C. And it also has a treatment that also be treated, but it has no vaccine. There's no vaccine for the C. Now the D. The D is a very interesting virus. The D is a parasitic virus. So viruses too can parasitize on another virus. We refer to the B as a helper virus for the D. The D can only infect somebody who has a resident B infection. So if you don't have the B, you cannot have the D, because the D uses the surface protein of the B to infect the cell. So you need somebody who has the B already before the D can cause an infection. And there are two types. You can have the B and then the D infecting the patient at the same time. And that's what we call co-infection. But you can also have a case where the person already has a long-standing B infection and then later comes in contact with the D. This is what we call super infection. So either case, the disease severity is increased. So both the super and the co-infection can lead to more severe disease. So that is the D for you. And we use the same vaccine for the B against the D because you have the same surface antigen. So if you are vaccinated against hepatitis B, then automatically you are also vaccinated against the D. Good. I've talked about the sexual transmission of the B, which is also another very important route of transmission. When you have the surface antigen of the B persisting for 6 months or more, then you are described as a chronic carrier. So that's a chronic case. So persistence of the surface antigen is very, very important in determining who has the chronic disease or who doesn't have the chronic disease. Yeah. WHO has set 28th July as World Hepatitis Day to raise awareness about the disease. And the focus is on viral hepatitis. And studies have shown that every 30 seconds somebody dies from hepatitis infection. So it is very important to raise this awareness so that those people who are unaware that they are infected can be tested, and then if they are positive, they will seek necessary help, and if they are negative, they can be vaccinated so that they will not have the infection. Then also, I've said earlier that it's very important to prevent infection in early life. And because these are the people who are most likely to develop the major disease. Of course, the older people too can get a disease, of course, but they are most likely also to clear the infection. So vaccination of young individuals can be increased, especially in developing countries where you may have a lot of areas which are endemic. So people can have this. Then also, it also allows awareness among organizations to fund the management and screening and all other activities which can lead to prevention of the disease or to lessen the spread of the disease. So funding agents can also be made aware about the need for support. So these are a few of the reasons why WHO has selected this 28th of July Day as World Hepatitis Day to raise awareness. And then people can now come for help and also prevent the spread of the disease. Yeah. It doesn't matter how it is initiated. Even if you don't have the virus as the agent initiating the cancer, they all end up in the same way. So you can have a cancer from hepatitis viruses or viral we call it oncogenic viruses. And this includes the hepatitis viruses, those which can cause the cancer. Then we can have other viruses involved, for example, papilloma virus and so on. Then you can also have chemical agents which can cause cancer. For example, a mutagen like ethidium bromide is a chemical. Then if you are exposed to some radiation, it is good for people to help accident victims. But in Ghana, we normally see people rushing and on accident victims and then handling. You may never know who has the hepatitis or any other blood infection. So it is very important in such cases to wear gloves, some protection at least, to lessen the contact with the blood, because you may never know who the accident victim is. And then also you need people who are professionals to help in such cases.